Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2024 first quarter part 7. In this video, we're going to cover two coding clinics. And the first one is, what is the correct ICD-10 CM code assignment for adding on phenomenon that occurred following previous spinal fusion for scoliosis correction? And the next one is it appropriate to assign a code for underdosing when a PRN medication such as albuterol is not taken? So let's get started with the first one. What is the correct ICD-10 CM code assignment for adding on phenomenon that occurred following previous spinal fusion for scoliosis correction? So before moving to the scenario, let us first see some terminology which will be helpful in understanding the scenario. Adolescent idiopathic scoliosis. Adolescent idiopathic scoliosis is an abnormal curvature of the spine that appears in late childhood or adolescence. Instead of growing straight, the spine develops a side-to-side curvature, usually in an elongated S or C shape. The bones of the spine are also slightly twisted or rotated. Adding on phenomenon. The adding on phenomenon is a common complication in adolescent idiopathic scoliosis patients after correction surgery. Now let us move toward the scenario. A 17-year-old patient with a history of thoracic adolescent idiopathic scoliosis has developed adding on phenomenon following a previous T2 to T12 posterior spinal fusion. The patient has developed progression of the lumbar curvature over the past year and now presents for a posterior spinal fusion of T2 to L3 for correction of the adding on phenomenon. Now the question here is, what is the correct ICD-10 code assignment for adding on phenomenon that occurred following previous spinal fusion for scoliosis correction? So the answer here is, we have to assign code M96.89 for other intraoperative and post-procedural complications and disorders of the musculoskeletal system for the adding on phenomenon that occurred following a previous posterior spinal fusion, and code M41.125 adolescent idiopathic scoliosis thoracolumbar region to further specify the disorder as directed by the instructional note at code M96.89. Also assign code Z98.1 orthodesis status since the patient is status post prior spinal fusion. Now let us move to the next scenario. A patient presented to the emergency department with shortness of breath due to an exacerbation of asthma. The patient did not take his PRN medication albuterol because he lost his inhaler. Coding Clinic first quarter 2021 pages 12 to 13 clarified that PRN medications are not classified as long-term drug therapy. So is it appropriate to assign a code for underdosing when a PRN medication such as albuterol is not taken? And the answer is, it is not appropriate to assign a code for underdosing when a PRN medication is not taken. Assign code Z91.198 patient's non-compliance with other medical treatment and regimen for other reason. Albuterol may help with the symptoms of asthma. However, it is not a maintenance medication, and the asthma exacerbation was not caused by the patient not taking albuterol. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.